Hi friends, how are you doing today? I hope that you are doing good. Well, from a last teaser, we come to know that what we are going to discuss in this video. Yes, it is a buddy rule. And you must be wondering that why we are straight away jumping from our denial management to a buddy rule. Well, let me explain one thing that I just got one request from one of the subscriber who wants to know about this topic. And if we'll jump to the denial management, right? So you know guys that denial management is a broad concept and it will take lots of videos. So I thought that let's first go with the buddy rule and thereafter we can go for our denial management. You know guys that we all know about some basic things about buddy rule, but here we are going to discuss some advanced level as well and you will enjoy it. But I just want to place a request to you guys that please watch this video till the end so that the concept will be clear to you about buddy rule. So guys, without wasting your time, let's get started. Alright guys, to understand a buddy rule in a better way, first we need to understand our meaning of dependent. Dependent is term in common language. We use this term when a person is relying on someone for certain periods and certain things, especially a family member depending upon another family member for financial support. For a professional way, a boss could depend upon manager can depend upon assistant manager or team lead, and team lead can depend upon subordinates to get the work done on time with the efficiency along with quality. So this is called dependency. When we are discussing about medical billing industry, so in this industry we use this term when a family member is depending upon another family member on their health insurance plan to meet their medical expenses. For an example, if I'm married, so I can enroll my wife as my dependent. So my health plan can meet all the medical expenses of my wife. Same way, like if we are having our kids, our children, so we can enroll our children in our health plans so that whenever they require a health attention or medical attention, so our health insurance can pay their bills. So guys, in this regard, we do have a act which is known as Affordable Care Act, which this act says that children as a dependent can stay on their parents' health plan until the age of 26. After that, no insurance company will reimburse on the behalf of the patient as a dependent on their parents' policy. They will rely on their own sources to meet their medical expenses. So here, in that case, insurance companies are finding a situation that when they are receiving a claim along with two insurance policies, for example, like they are patient as a dependent enrolled with mom and dad's health plan. So now they have to decide that whose plan will cover first and whose plan will cover next. So for this purpose, to resolve the situation, National Association of Insurance Commissioner comes up with a buddy rule to resolve this kind of a situation and to coordinate between the pairs for their benefits. So guys, here in this video, we'll learn about the basic buddy rule and the exceptions, like what if parents are having same date of birth and month, what if we are legally divorced, what if a custodian parent remarried, what if we are having a custodian member or divorcee, what if we are having any parent are having a group health plan or individual health plan, what if a divorcee enrolled with Cobra plan. These are the exceptions. As we know that, guys, this buddy rule means to establish a coordination of benefits between the parents' insurance policies. So here we have to understand a difference between COB and this buddy rule. At last, we'll try to understand that whether all health plans are going to follow this buddy rule or not. So these are the things what we're going to discuss in this video. I hope that you will enjoy it. Be still here. Alright guys, so this is our first topic, which is the general buddy rule. What it says, let's see that. In a general buddy rule, first we have understand that when this term kicks in, when we use this term, whenever a patient as a dependent enroll with two policies, two health plans with the mom and dad, in that case, insurance company needs to identify whose plan will cover as a primary and whose plan will cover as secondary. In this typical buddy rule, we are just concentrating on date of birth and month. We are not considering a year of the parents. For example, like my date of birth is December 1, 1984, and my spouse's date of birth is January 1, 1985. So in that case, in a calendar year, January comes first, then December. Okay, so in that case, my wife's health plan will be a primary and my health plan will be a secondary. Let's take another example. My date of birth is January 10, 1985. My spouse's date of birth is January 5, 1979. 79 is greater than 85, but we are not considering a year. We are just going month and date. So my date of birth is 1/10 and my wife's date of birth is 1/5. Again, in that case, January is a month, so it's the same month, but the date coming first, my spouse date coming first, then me. In that case, my wife's health plan will cover as a primary and my plan will cover as a secondary. So by this rule, by applying this rule, they have cut out this kind of a coordination benefit. But guys, you know that we are having a certain situation in which this buddy rule doesn't apply. So now here we'll understand what all kind of exceptions lying in this rule. Okay guys, so now the first point is, what if the birth date and the month of the parents are same? In the first point, what are the basic rule of the buddy rule? We have understand that to identify who is insurance primary, they will go for the year. They will go for the date and the month. But what if now when the date of birth and month are same? In that case, we cannot apply a buddy rule. So in this exception, to identify who is insurance primary or who is secondary, they're going to identify by that, like they just identify that whose health plan covers longer than other. For example, like if I have taken my policy in the year of 1990 and my spouse has taken their policy in the month or in the year of 2015. So yes, so the continuation of my plan is longer than my spouse. So by that, they will treat my plan as a primary and my spouse plan will be secondary. So this is the exception in which they are not applying a buddy rule. They are not identifying who is primary or secondary on the basis of date and month. So to identify that, they are just going whose health plan is longer than other. So our next point is, what if we are legally divorced or separated? Well, in that case, if we are legally separated or if we are divorced, so in that case as well, a buddy rule will not apply. This is another exception in which a custodian parent or divorcee plan will a custodian health plan will be a primary for him, for the children, and the other one, a non-custodian health plan, will be a secondary. But there is an exception as well in this term as well. Like if a custodian parent is having a individual health plan and a non-custodian parent is having a group health plan, so in that case, in that scenario, there will be the non-custodian parent's health plan will be a primary, and a custodian parent's health plan will be a secondary. There is one more exception in that if, as our case in a court, so if court has been decided that to a specific parent's health plan as a primary, so that plan will be act as a primary in the case of separation. So the next topic is like what if our ex-spouse remarried, or a custodian parent remarried to someone. In that case, remember first what was happened? A custodian parent will be a primary and non-custodian parent will be secondary. But here, if the custodian parent getting remarried to someone, in that case, the custodian parent health plan will be primary, his new spouse health plan will be secondary, and if there is any remaining responsibility lying, then the non-custodian or ex-parent will be a tertiary health plan. And just remember one thing, that if non-custodian parent will remarry, it will not impact anywhere. Initially, his policy was secondary, and even after that, his policy will be secondary. But the impact will come when the custodian parent remarried to someone. What if one of the divorcees have a COBRA health plan? In that scenario, if other person are having enrolled with a group health plan, so that plan will cover as in primary, and COBRA will come next to that plan. As we know that the COBRA health plan, to continue with this plan, we have to pay heavy premium and out-of-pocket expenses. So that is the reason that a group health plan or individual health plan will be act as in primary, and the other one, a COBRA health plan, will perform as in secondary. So we are going to hitting up a next exception. If any one of the spouse or ex-spouse are having a group health plan or individual health plan, then whether we will apply a buddy rule or not. Yes, buddy rule depend upon the plan as well. If like anyone are having a group health plan or individual health plan, it matters. In that case as well, we cannot apply a buddy rule. For example, like if I'm having a group health plan and my spouse is having an individual health plan, so whosoever is having a group health plan will cover as a primary, and who is having an individual health plan will cover as a secondary. So here we are not applying a buddy rule. So we are just understanding what are all exceptions in a buddy rule. Okay, so we have taken care of all the exceptions as well, and about the buddy rule and the exceptions. So now here we are going to see the difference. So far we have noticed that both the concepts are applying to establish a coordination benefit amongst the pair. So however, there is a slight difference between them. So here we are going to identify what are all differences between them, so that we can differentiate coordination benefit with buddy rule. Let's understand with the help of the table running behind of me. We are having 3 tabs here: reason, COB, and buddy rule. First, reason applies. We are trying to understand here when these rules applies. So coordination benefit applies when a dependent or a policyholder or a subscriber enroll with more than one health plan, then it applies. It's a broad concept. When buddy rule applies, It applies when a children as a dependent enroll with more than one health care plan. Next point is nominate. Who nominates? That who will pay first and who will pay second. In Scottish benefit, subscriber or policyholder does have that right to make a selection that who will pay first and who will pay second. But in the case of Buddy Rule, the insurance companies or health plan identify on the basis of the month and date that whose birthday is coming first in a calendar year. On that basis, they are going to identify that whose insurance plan or health plan will be primary and whose health plan will be a secondary. Then the next point is court interference. While selecting a coordination benefit, there is no court interference. But yes, in the case of a Buddy Rule, court may declare that court can come up and to identify that whose insurance will be primary or who or not, who will be a secondary. Next point is concept. Concept means it is a coordination benefit is a broader concept. It includes dependent. And dependent, they include children and the spouse as well. But it is in a part of the COB. But Buddy Rule is a part of a COB, in which they are just considering children as a dependent. So it's a part of the coordination benefit, and the coordination benefit is a broader concept. These are the differences which will help us to make a differentiate between coordination benefit and Buddy Rule. So at last, we are going to understand that whether all insurance companies are following this Buddy Rule or not. So let me clear one thing, that this is just merely a rule. It is not a law. And insurance companies are independent whether they are following this rule or not while processing the claim. So whenever we are going to purchase a health plan or whenever we are going to check verifying the eligibility, we can, and in this scenario when we are having a dependent as a children and they are having more than one or two policies enrolled with two policies, so while checking the eligibility, we can confirm with the rep that whether they are following a Buddy Rule or not. So it will be clear to us that whose insurance policy will be primary and whose insurance policy will be secondary. So guys, that is what actually we have understand here of Buddy Rule and their exceptions and whether all insurance companies follow this rule or not. I hope that you enjoyed this video. For our coming video, yes, we will discuss about the denial management. I'll give you a teaser about the denial, that what denial topic I'm going to pick, and then you can come to know in advance that what we are going to do. Thank you for your all support and have a great